Every mama's journey is different, and you need to appreciate that. For some women, they glow up. When you see them during pregnancy, it's as if they just came back from holidays. They are fairer, even when they are dark, their skin is just popping. And there's nothing you can do about it. It's just their nature. But if you're a mama like this, there's no need for you to sweat about it or get worried. Everybody's journey is different. So embrace your own popping skin. All right. Then there are people that have acne, or have, we call it, pimples on your face, maybe on your chest or on your back. These things are due to hormonal changes in pregnancy that leads to those breakouts. And you know what? Of course, I know you loved your skin before you got pregnant if you are experiencing acne, but this acne is not a lifelong breakout. It's going to get better with time after delivery. All you need to do now that you're having acne is to reassess your product, especially if you're on a routine. Reassess your product, and the best thing to do is to know that simple does it for pregnancy. When you want to incorporate a skincare routine for your acne in pregnancy, don't bring in more products. Instead, reassess what you already have and reduce what things that are not necessary. For instance, you can just start with your basic facial wash, your moisturizer, your sunscreen. Sunscreen, very important. So I used to talk more about that. Sunscreen, and then maybe your vitamin C. Just keep it simple and make sure that your skin is always moisturized. Okay. Another skin changes that is very common to almost all pregnant women is melasma. I'm going to attach a picture here to show you what it looks like. When it is as if they are just bringing dark patches of skin on your skin. Your chin is dark, your elbow is dark, your chest is dark, in between your laps is dark, your bum is dark. You just have dark patches everywhere on your skin. And these changes are also due to hormonal fluctuations in pregnancy, due to the new hormones, not really new hormones, but due to increased level of estrogen and progesterone in your body. And also it causes increased secretion of hormone that increases your pigmentation, which is melanin. And due to this effect, your skin feel like somebody is rubbing charcoal on it, but this charcoal is actually not smooth. Everyone knows that, oh, there's patches of dark patches on your skin. This is called melasma. And as always, melasma is worsened by sun exposure. So this is why you need to be very, very religious with your sunscreen. You need to be very religious with your sunscreen and your moisturizer to make sure that the impact is not worsened by sunburn and other changes that happen due to sun exposure. Another changes that no woman ever wants is stretch mark. Stretch mark is very annoying, to be honest, but it is something that happen, but it doesn't happen to everyone. It doesn't happen to every woman. It happens to whoever that is experiencing it. That's why when you come on social media, you see women sharing their pregnancy journey and you get depressed. You feel this low mood, like, is it not the same pregnancy that we have been through, that these ladies are being through? Why are they not getting stretch marks? And I'm the one getting stretch marks. I'm having acne. I'm having melasma. Me again, I am having stretch mark. Things like this can make you feel like, oh, maybe you're abnormal or there's something abnormal about your pregnancy. There's nothing abnormal. It's just your own genetic makeup. It's just your own body reacting to the stretching of your skin. When your baby is increasing in size, it stretches your skin, it stretches your muscle. The muscle tears into the skin, and these things, it tears into the fat layer, and this thing gives rise to stretch marks. What you can do for yourself is to start moisturizing your tummy and your skin early enough in pregnancy. It's not like it's going to stop it entirely, because there are some people that will moisturize even with aloe vera or other water-based moisturizers that they have, still they will have stretch mark. But I've noticed that moisturizing, from my experience too, when I was pregnant, I used aloe vera moisturizer. It helped to reduce the itching that comes with the stretching of the skin. Not necessarily because it's going to stop the stretch mark from happening, but that discomfort from scratching in the public, scratching everywhere, feeling irritation, I eliminated it completely, because I kept moisturizing every 2 to 3 hourly, because it was COVID, of course. I still had to all through. But make out time to moisturize your skin and to reduce itching, reduce dryness, and of course, it can also improve the rate at which the stretch mark is going to appear on your skin. Another common complaint that I usually get from women during pregnancy is itching. Everywhere is itching, your skin, even your vagina is itching you. Everywhere is itching. These things are caused by hormonal changes. But some of the skin itching and rashes that you experience are usually due to the dryness of the skin. And some of these dryness of the skin are not primarily caused by pregnancy. Some of them are caused by skin products, maybe soap or body wash that we were using before pregnancy. So sometimes it might not even be changing your routine. It might just be, like I said, eliminating the offending products. That product, if you are using a product that foams a lot, that forms lather, soaps or body wash that forms lather, it's going to dry up your skin faster. Especially if you live in the tropics like Nigeria, Ghana, Africa, if you're within Africa, or you live in a very hot climate zone, it's going to dry out your skin and expose you to irritations. All right, I've noticed that sometimes when women complain about skin itches and irritation, when you prescribe, let's say, antihistamine for them, they still come back with the same complaint. But when you try to analyze their skin product and the things they use, you find out that, oh, there is actually an offending product within their routine, and once you remove it, you see that everything returns back to normal. And of course, keep moisturizing. I always say that keep moisturizing, very, very important for you. The last but not the least is linear nigra. I'm going to attach a picture here. It's just that line that runs in front of your tummy to your belly button down to your pelvis. As your pregnancy is increasing in age, the line will keep tracing. Medically, we also use the line to trace the age of your pregnancy. That line used to worry a lot of women. You're like, where is this line coming from, and when is this going to fade? Is it going to ever fade? Yes. For most women, like majority of women, that line is going to fade after delivery. 6 weeks to 8 weeks after delivery is going to fade. For some other women, it's going to take a longer time. And for just a little percentage of women, it may just not fade completely. It may just be a little darker than your actual skin, and it's just going to be there. But you know what? It doesn't really matter, because this is just an evidence that you're a mother, you went through motherhood, and there's nothing to be ashamed about it. So don't try to bleach it or do anything about it. Give it time to fade, and if it doesn't fade completely, it's okay. As long as your skincare routine is healthy and okay for you, don't try to worry about it so much. We win some, we lose some. Just see this as part of the win that you may never be able to get over. All right. There are other changes that happen on your skin, like skin tags. I'm going to attach a picture to show you what a skin tag look like when it sprouts out from your skin. Those ones, don't bother about them, because sometimes after pregnancy, not just sometimes, many times after pregnancy, those skin tags fall off on their own. They just diminish. But the ones that are remaining, you can now see a dermatologist to see if you require treatment or just require observation for over a period of time. There are other skin changes, also in diseases like vitiligo, when I'm going to also attach a picture of what it looks like that will require professionals to look at it. When you notice some of these changes, you need to speak to a dermatologist, not people that miss cream. Please speak to a dermatologist to make sure that they assess the skin condition you have and give you proper counsel. Finally, you need to be very patient with your skin. Yes, skin changes are normal in pregnancy. You may have A or B or a combination of what I've already listed, but you need to be patient. These changes happened over 9 months. In the coming videos, I'm going to show you how these changes occur, when they start, the impact they can have on your health or your life, and so many other things that I have here. And of course, we're going to discuss list of products that you can use, the one that you cannot use during pregnancy. So make sure that you put on your notification to know when I drop a new video every week. All right, see you in my next video.